Anti-hypotensive drug, alpha and beta-adrenergic agonist, norepinephrine bitartrate. Indications of norepinephrine bitartrate: blood pressure control. It is used to control blood pressure in specific acute hypotensive conditions such as pheochromocytomectomy, sympathectomy, poliomyelitis, spinal anesthesia, myocardial infarction, septicemia, blood transfusion, drug reactions, adjunct in cardiac arrest. It can be used as an adjunct in the treatment of cardiac arrest to help restore normal blood pressure. Therapeutic class: alpha and beta-adrenergic agonist. How norepinephrine work. Norepinephrine is a direct-acting sympathomimetic which stimulates beta-1 and alpha-adrenergic receptors. Its alpha agonist effects cause vasoconstriction, thereby raising systolic and diastolic BP with reflex slowing of heart rate. Dosage and administration: norepinephrine. Diluent. Norepinephrine should be diluted in 5% dextrose injection or 5% dextrose and sodium chloride injections to protect against potency loss due to oxidation. Saline solution alone is not recommended. Whole blood or plasma, if needed, should be administered separately. Average dosage. Add the contents of a 4 mg divided by 4 ml ampoule of norepinephrine to 1 ml of a 5% dextrose containing solution. Each ml of this dilution contains 4 mcg of norepinephrine base. Administer via intravenous infusion, carefully monitoring the rate of flow. Adjust the rate to maintain a low normal blood pressure. In hypertensive patients, avoid raising the blood pressure higher than 40 mm Hg below pre-existing systolic pressure. The average maintenance dose ranges from 0.5 ml to 1 ml per minute. High dosage. Titrate norepinephrine dosage according to the patient's response. Higher doses may be necessary, but occult blood volume depletion should be suspected and corrected. Central venous pressure monitoring is helpful in detecting and treating this situation. Adjunctive treatment in cardiac arrest. Use norepinephrine intravenously during cardiac resuscitation to restore and maintain adequate blood pressure after establishing effective heartbeat and ventilation. It can enhance systolic contractions. Interaction. Anesthetic interaction. Cyclopropane and halothane anesthetics increase cardiac irritability and may sensitize the heart to intravenously administered epinephrine or norepinephrine. Therefore, using norepinephrine during these anesthetics is generally contraindicated due to the risk of ventricular tachycardia or fibrillation. Risk in hypoxia or hypercarbia. Norepinephrine use may also lead to cardiac arrhythmias in patients with profound hypoxia or hypercarbia. Interaction with MAOIs and antidepressants. Extreme caution is required when using norepinephrine in patients taking monoamine oxidase inhibitors or certain antidepressants. This is because it can result in severe and prolonged hypertension. Contraindications. Hypotension from blood volume deficits. Norepinephrine should not be given to patients with hypotension due to blood volume deficits, except in emergencies to maintain coronary and cerebral artery perfusion until blood volume replacement can be completed. Continuous use without blood volume replacement can lead to severe vasoconstriction, decreased renal perfusion, poor blood flow despite normal blood pressure, tissue hypoxia, and lactate acidosis. Mesenteric or peripheral vascular thrombosis. Norepinephrine should not be administered to patients with mesenteric or peripheral vascular thrombosis unless it is deemed necessary as a life-saving procedure, as it can risk worsening ischemia and extending infarcted areas. Contraindications. Anesthetic interaction. It is generally considered contraindicated to use norepinephrine during anesthesia with cyclopropane and halothane due to increased cardiac irritability, which can lead to ventricular tachycardia or fibrillation. Risk in hypoxia or hypercarbia. Using norepinephrine in patients with profound hypoxia or hypercarbia may result in cardiac arrhythmias. Side effects. Body as a whole. Ischemic injury due to potent vasoconstrictor action and tissue hypoxia. Cardiovascular system. Bradycardia, possibly due to a reflex response to increased blood pressure. Arrhythmias. Nervous system. Anxiety. Transient headache. Respiratory system. Respiratory difficulty. Skin and appendages. Extravasation necrosis at the injection site. Prolonged administration may lead to plasma volume depletion, requiring fluid and electrolyte replacement therapy. Pregnancy and lactation. Norepinephrine is pregnancy category C type drug. There have been no animal studies conducted on norepinephrine to assess its impact on reproduction. It is also unclear whether norepinephrine can harm a developing fetus when administered to a pregnant woman or affect their reproductive capacity. Therefore, norepinephrine should only be administered to pregnant women when it is clearly necessary. Additionally, it is not known whether this medication is excreted in human breast milk. Since many drugs can pass into breast milk, caution should be exercised when administering norepinephrine to a nursing mother. Bangladeshi brand dosage strength company, noradrenaline, Actant IV infusion 4 mg divided by 4 ml ZAS Corporation. Naxner IV infusion 4 mg divided by 4 ml Healthcare Pharma. Levoft IV infusion 2 mg divided by 2 ml Beacon Pharma. Hyponor IV infusion 2 mg divided by 2 ml Square Pharma. Levoft DS IV infusion 4 mg divided by 4 ml Beacon Pharma. Innovator brand, Alleviate PHED, Ciba Pharmaceuticals, USA. If you like this videos, please subscribe. Push the bell icon for getting more videos regarding Medicine World. Thanks for watching.